Ever been to a music festival?
Oh, yeah.
Picture this, the sun's beating down,
Yeah,
the music's pumping, everyone's vibing, right?
absolutely. That energy's electric.
But under that carefree vibe, what if there's this, like, hidden danger lurking?
Oh, wow.
What if you couldn't be sure what's really in those drugs being passed around?
Yeah, that's a scary thought.
It's a scary thought, and it's a real thing for a lot of festival goers.
Right.
Today, we're diving deep into a study from Australia,
Okay.
tackling this issue head on.
Sounds good.
What do you think?
Yeah, this is going to be good.
So this study zooms in on the Northern Territory in Australia.
Interesting.
It's this unique blend of urban and remote communities, including a big indigenous population.
Okay.
They looked at attitudes towards drug checking at a music festival there. And the findings, well, they're pretty eye-opening.
Oh, I'm curious.
So we're not just crunching numbers here. We're understanding them in the specific context of the Northern Territory. Why is that so important?
Well, the Northern Territory has a history of being quite adaptive with harm reduction and drug policy.
Interesting.
It's a fascinating case study.
Yeah.
This region's got a diverse population and geographic challenges, meaning any solution has to be sensitive to those nuances.
That makes a lot of sense. Okay, so let's get into the study itself.
Right.
It happened back in May 2022 at a single-day music festival.
Oh, okay.
Researchers surveyed 539 attendees, 16 and over,
Gotcha.
and the median age was 25.
So not just teenagers then?
No, not just a crowd of teenagers. This gives us a broader look at how different age groups view drug use in this setting.
Right. Makes sense.
One of the first things that jumped out at me was the drug use reported.
Oh, really?
40% of those surveyed said they used drugs, not including alcohol, in the month before the festival.
Wow. That's significant. Much higher than the general population, I'd imagine.
It is.
Yeah.
And the most common drugs, cannabis, cocaine, and MDMA.
It really highlights how common drug use is at events like these.
It does.
And why harm reduction is so important.
Absolutely. So knowing drug use is fairly common at this festival, what did this study say about people's feelings towards drug checking?
Well, this is where it gets really interesting.
Okay.
73% of all participants.
Man.
And that includes those who didn't use drugs. They supported drug checking.
That's a huge majority. Seems like there's a growing awareness and acceptance of harm reduction, as a public health approach.
It seems that way, and what's even more fascinating is that older attendees were more likely to support drug checking than younger ones.
Hold on, that flips the script, doesn't it? You'd think younger generations would be more open to these ideas.
You would, wouldn't you?
Yeah.
It challenges that assumption that older generations are more conservative about drug use.
Right.
It could mean attitudes are shifting over time, maybe influenced by seeing the effects of the opioid crisis or just recognizing the changing landscape of drug use and the risks.
Yeah, that's a really good point. It makes you wonder if they're thinking about the safety of younger people at these events, not just themselves.
Exactly. They might be using their own life experiences and understanding the potential dangers more clearly.
The study also found those who had recently used drugs were twice as likely to support drug checking.
That makes sense. They're facing the risks of unknowingly taking adulterated or misrepresented substances.
They're on the front lines.
Exactly.
So there's a real sense of urgency there.
For sure.
Now, let's talk about how people want to use drug checking services. The study asked about their preferred methods, and the answers were pretty revealing.
Oh, okay.
So of those who said they'd use the service, most preferred testing both on-site and off-site.
Interesting.
But they strongly preferred on-site use, like right before they plan to take the drugs.
Makes sense. They want that info right when they need it.
Exactly. It's about meeting people where they are, literally.
Yeah.
And it makes sense they'd want to check right before use, especially in a fast-paced festival setting.
Definitely real-time info for their choices.
And a whopping 79% said they'd feel safer at a festival with on-site drug checking.
Wow. So even if not everyone uses it, the idea of having it creates a sense of security.
It does. It's like a safety net.
It is.
But we have to remember, this is just one piece of the puzzle.
Right.
That's what makes this deep dive so interesting. We're not just looking at numbers. We're looking at this issue in a specific context.
Absolutely.
And even in this one study, there are layers of complexity and surprising findings.
Yeah, for sure.
As we move forward, we need to keep in mind that unique mix of communities in the Northern Territory and its history with drug policy.
Right.
These factors are crucial in understanding drug checking's potential impact and how to implement it effectively.
I agree.
Okay, so we've laid the groundwork, but there's still more to unpack. This study raises a ton of questions. We're
Yeah.
just scratching the surface.
We've explored the who, what, and where,
Right.
but now it's time to dig into the why and the how.
Exactly, and that's where things get really interesting.
It's important to remember, even with the strong support, drug checking is still a bit contentious in Australia.
Well, and that's interesting. So even with this study showing support in the Northern Territory, it doesn't mean it's a universally accepted idea across all of Australia.
Exactly. Harm reduction does align with Australia's national drug strategy,
Okay.
but historically the country has leaned towards law enforcement and zero tolerance.
So even with these shifting attitudes, there's still this tension between public opinion and actual policy.
You got it. This research adds to a growing body of evidence suggesting people want more progressive harm reduction.
Yeah.
But turning that desire into policy change is a whole other challenge.
It's like a puzzle, isn't it? You've
Yeah.
got public opinion, scientific evidence, political will, social stigma.
Right.
All these pieces need to fit together for real change.
And the Northern Territory, with its unique context, could be a fascinating case study.
Yeah.
But we have to acknowledge the study's limitations. It didn't go deep into the perspectives of Indigenous communities who could be significantly impacted by any policy changes.
That's an important point. Any harm reduction strategies need to be culturally sensitive and address the needs of all communities, especially those who have been marginalized.
Absolutely. And when considering the impact of drug checking,
Yeah.
we need to think beyond individual behavior. How could it change the dynamics at festivals? Could it lead to more open conversations about drug use and safety?
It's fascinating to think about the ripple effects. Could it reduce the stigma around drug use, allowing people to get help and info without judgment?
These are all great questions needing further investigation.
Yeah.
This study is a valuable snapshot, but it's the start of a much larger conversation.
Feels like we're on the cusp of something big here.
Yeah.
We're seeing the devastating opioid crisis unfold globally. Could drug checking be part of preventing those tragedies?
It's possible, but we need to consider what type of checking service would be most effective. The study highlighted a preference for both on-site and off-site,
Yeah.
but the feasibility and cost-effectiveness in the Northern Territory needs careful thought.
And the vastness and sparse population of the Northern Territory,
Right.
with its remote communities, accessibility for everyone, not just those in urban areas, is key.
A mobile drug checking service might be more practical there,
Okay.
but that needs significant planning and coordination.
It seems like no matter which approach you take, there are challenges.
Yeah.
And we can't ignore the elephant in the room, the broader issue of drug policy.
Right.
As long as we criminalize drug use, won't there always be barriers to these services?
Absolutely. That fear of legal repercussions can stop people from seeking help or even acknowledging their drug use.
It can.
So any meaningful change needs to happen at a policy level.
It's like we're this crossroads. This growing evidence supports harm reduction, but it clashes with outdated policies and social stigma.
And that's where the real work starts, bridging that gap, educating the public, and advocating for policies that prioritize public health over punishment.
Sounds like a long road ahead.
It is.
But these studies give us hope we're moving in the right direction.
They offer valuable insights into how people think about drug use
Right.
and what they need to make safer choices.
That's what it's all about, empowering people with information and resources to stay safe and healthy.
Yeah.
But we have to look at the other side. What about those who criticize drug checking? What are their concerns?
One argument is that it sends the wrong message, condoning drug use rather than discouraging it.
That's a valid point, but doesn't the evidence show that drug checking doesn't actually increase drug use?
Exactly. Studies show people using checking services are more likely to dispose of dangerous substances or reduce their consumption. It's not about encouraging drug use. It's about harm reduction.
So meeting people where they are and giving them the tools to make informed decisions.
Precisely. And in a festival environment where people experiment and take risks, those tools can be life-saving.
Yeah.
But it's not just festivals. Think about nightclubs, community centers, even within existing healthcare services.
It's intriguing to think about them becoming more mainstream, providing a non-judgmental space to get drugs tested and receive harm reduction advice.
That could change the game.
It could.
Integrating it into mainstream healthcare would destigmatize drug use and make access easier.
And provide valuable data on drug trends and adulteration,
Okay.
helping us understand and respond to threats.
It's a win-win.
It is.
While this study was about music festivals, the implications are wider.
It's a reminder to constantly evolve our approach to drug policy and harm reduction,
Yeah.
adapting to the changing drug landscape.
Always prioritizing health and well-being.
You're right. Before we wrap up,
Yeah.
I want to go back to unintended consequences of drug checking.
Right.
What are some concerns?
One concern is that it might create a false sense of security, leading people to believe any drug that passes is completely safe.
Like, okay, it's checked, I'm good to go, without considering other factors.
Exactly. Drug checking only tells you what's in that sample at that time.
Right.
It can't predict how it interacts with other substances or a person's physiology.
It's like a car safety inspection. Tells you if your brakes are working now, but not if you'll get a flat tire later.
Great analogy.
There's always risk.
That message needs to be clear and consistent.
It does.
Another concern is it could normalize drug use, especially among young people.
That's a worry for many, but young people are already exposed to drug use, whether we like it or not.
Absolutely. Ignoring it won't make it disappear.
Right.
With accurate info and harm reduction services, we can empower them to make informed choices and reduce risks.
Shifting from punishment to prevention.
Exactly. Creating a culture of open dialogue and support.
So, while there are potential drawbacks, the benefits of saving lives and reducing harm seem to outweigh those concerns.
Many experts in the field share that perspective.
But it's an ongoing debate, one we need to have thoughtfully and respectfully.
Absolutely. Like any complex issue, there's no easy answer.
Right.
But by listening to the evidence, considering different views, and prioritizing public health, we can move towards a more compassionate and effective approach to drug policy.
That's a great point to end on. This has been a fascinating deep dive.
Yeah.
We've explored the growing support for drug checking, the potential benefits, and the challenges.
We have.
But now it's time to move on to part 3 to wrap things up. This conversation about drug use and harm reduction, it feels like we're at a turning point.
Yeah, it's encouraging to see these studies,
Right.
and this shift in opinion towards a more compassionate and evidence-based approach.
As we wrap up this deep dive, what are some key takeaways for our listeners?
Well, drug checking isn't a standalone solution. It's one part of a bigger harm reduction toolkit.
So it's not a magic solution to eliminate all risks.
Exactly. It needs to be part of a larger strategy.
Right.
Education, prevention, treatment, support services. We got to address it from all sides.
And it's about empowering people to make informed choices, right?
Yes,
Yeah.
giving them accurate info about what they're taking
Yeah.
so they can weigh the risks and benefits and decide what aligns with their own values.
Respecting their autonomy,
Yeah.
giving them the resources to stay safe.
And hopefully, those choices lead to fewer tragedies and a healthier community.
That's the goal, to make drug use less harmful and more humane.
Absolutely, the path to that goal might be long.
Yeah.
But studies like this give us hope.
It
Show us that conversations are changing, harm reduction is getting attention,
is.
and people are more willing to embrace solutions based on evidence.
So, for those continuing to explore this topic, what would you say?
Keep an open mind, consider different perspectives,
Yeah.
and talk to those who might have different views.
Because it's through collaboration and compassion that we can make a difference.
Well said. It's time to wrap up this deep dive.
This has been so insightful. Thanks for guiding us.
My pleasure. Remember, knowledge is power, especially when it comes to your health.
And if you're curious, keep exploring. Don't be afraid to ask questions, challenge assumptions, advocate for change.
Together, we can make harm reduction the norm, where everyone has a chance to make safer choices.
Until next time, stay curious, stay informed, and stay safe.